Uh, all right. So you are a registered nurse
Yes, been a
and
nurse for 6 years.
for 6 years. Okay. And what what made you want to get into becoming an RN?
Um, well, my grandma, when I was about 16, got me put on to a home health job that she was also working on. They needed somebody for the nights and weekends. And I was down for whatever was going to pay. I really had no expectation, just that it was going to pay. And it was a dementia related case. Um, really, I really enjoyed it. I liked helping her. And then when it came to after I graduated, I just really didn't go to school right away and eventually found myself needing higher pay, higher education, and went to CNA because I'd continued other home health jobs along the way, but wanted more pay for it. So I got my CNA, and I did that for about, I don't know, 4 years before becoming an RN. And I always loved it. I never expected to get into RN. I didn't really have high expectations for myself. And it was my CNA instructor that really pushed me, Linda Miller, God love her, sweetest soul you'll ever meet. Yep. So she told me I was supposed to be a nurse.
Okay, okay.
And
That's freaking awesome, man. Like
yeah.
uh and what kind of what kind of facility did you first start working at?
With the certificate was a nursing. And so it was pretty much a larger base of what I'd already been doing. I'd been doing individual home health cases. And so it was just a building packed full of those different types of cases.
Okay.
So time management, like I was used to doing the job like at home over 6 hours, one patient. Yeah,
Okay.
it was
When you for
large awakening.
oh sorry, when you first started with your RN license, what kind of work were you doing?
I was still in the nursing home at that time, and I was there for about a year before COVID came in nursing. So I started nursing in 2019. I remember sitting at the desk as an RN, watching it on the news, and thinking, "Oh, that'd be terrible." It came over here, and yeah, it did, and it kind of ruined me on nursing homes. I have a love hate relationship with nursing homes. Some of the best CNAs nurses I've ever met have all been from nursing homes. Um, but what management doesn't allow, everyone complains. Like they tell us to turn your grandparents every 2 hours. They pee so many times in between 2 hours. We can barely get through one hall in 2 hours, and then everyone's already wet again, and they have to go eat or go to physical therapy, and there's just never enough hands, and so they just always get such a terrible rep. And it's just not always the case. There's like you can only do so much, and then they get burnout, and yeah, it's nursing homes are love hate relationship.
Yeah. So like what kind of things did you guys have to deal with over there during COVID?
Well, the night that I walked out, I'd walked in. They told us in advance we had took trainings on it. They would set up a COVID hall if it came in. We would have designated nurses and CNAs for those halls that would work at extra pay and be willing to do those things. So I had been off for a couple days, and I had, of course, heard through other colleagues that it had came into the building. Um, but nobody had called me and asked me to work it or told me that additional pay or any of those things. So I go to the charge desk, and the nurse that's there lets me know that she had just got off the COVID hall. There would be no additional nurses. I would be the only nurse there that night covering the COVID hall with 20 patient residents and 60 other residents on the other two halls. And I would have two CNAs to do all of those things. And I just refused the position and walked out.
Okay.
Of course, the administrator, did not support me, was not able to collect unemployment or anything off of that. And was pretty much given an ultimatum to either come back to the job that night or I was going to be fired. The administrator even told me at one point, she's like, "You don't have to do anything. You don't have to go in the COVID hall. I just need a body in the building." And I'm like, that is unacceptable. But of course, when it came to, like I said, unemployment meetings and things like that, hearings, she did not Nobody ever is. I don't know what my expectation is. I am just so honest. I expect other people to be.
As important as nurses are, and it's almost like, you're a lot of times you guys are treated as expendable. I think that's ridiculous. Uh, so
It is.
so after you left there, you I'm sure you found another place. After that, what kind of work were you doing? Without being specific.
It's hospital nursing, med surge,
Okay.
surgical,
And when you
those types of things.
so going into hospital nursing, what kind of work were you doing there?
You know, a lot of TERPs, bladder surgeries, med surge was, was dehydration, you know, sepsis, things like that. Nothing too severe. A lot of behavioral patients, a lot of older patients. And COVID had really just kind of settled down then, and we had a small unit with COVID on it. And at that time we would fully mask up, but they wouldn't have us in the COVID population mixed in with the other patients too much at all. But it was still like it happened at that time then, and that was right before the mandate come out because I was pregnant, and when the mandate came out, I refused it being pregnant, and I had the choice to either quit or if they I quit because if I didn't quit and I was fired based on the refusal of the mandate, it there would have been punishments through that route as well. So I just voluntarily quit rather than
You got to protect
having
that
to come back to
license,
the floor. Yeah, yeah.
Understandable, Dana. So, like, after you got done with that, you went on and uh, when I met you, you were working behavior, correct?
No, so I came right into supported living. I had stayed home after the hospital. I stayed home, had a baby, and then the DON at the time had really pulled me in. Somebody else had tagged me in one of her posts of needing the RNs, and I messaged her and joked, and I was like, there's no way I could get on. I don't have a continuous babysitter, and yeah, she got me in there and convinced me, and I went back to work again because you face so many things negatively within your management as a nurse. The first experience as a nurse, with the unacceptable um, job that they wanted me to do that night, and then you run into the vaccine mandates, and you have no control over your body as a nurse. Like you have to just bend to whatever the facilities you're working at. You have to choose between the livelihood for yourself or your family at worst, or just putting whatever into your body. It's very
Crazy that, like treat nurses
yeah,
that way, like as, as
yeah.
useful as you guys are, like you'd think that there'd be a bit of, a bit of give, but a lot of times I see that with you
We're
guys.
just bodies. We are just bodies.
So when you started your next position, um, give me some examples of some of the things you had to deal with, uh, and how you got through those days as well.
Um, Examples of like negative things,
Either way,
like
negative and positive. Like things that you enjoyed about the job and things that you despised about the job.
I really loved it at first. I really thought it was going to be something that was life changing. And then when I found out they had a kids program from traumatized children, behavioral, um, and they're going to go into an adult program, we're going to help lead them into life. But it's just psych med after psych med. The staff who aren't prepared for them, re-traumatizing them, hitting their trainers.
Uh, was there anything that you would have changed about the way that was being done?
So many things. Some of the workers were in place, like they would find so much spite, like power trips. And you could see, like I remember being raised the way that these staff wanted to treat the residents living there. Um, that harsh love that you learn being pushed, the heartfelt things that don't matter, no understanding that that's their home and that they should feel like they're at home. No oversight. Um, you know, they literally were just bodies in the building. And, the patients were allowed to have sex. The patients were allowed to beat each other up. The patients, you know, there was no diet control. There was, all of these younger kids, you could see their chronic conditions building up with all of the different psych meds and uh,
That's crazy. Like, uh, now when you've had instances where you yourself was in the house and or in wherever you were working at. Have you ever had someone that you know just approached you the wrong way, whether it be staff or a client, and you had to deal with that in itself?
yeah, absolutely. And in a lot of the houses, like I said, we're in it's not a big city, but it's a city nonetheless. And then bigger cities pour into it because it's a university town, and we would get that diversity that I was looking for, but it was so much not understanding. It was so much impoverished love. That's all I can call this impoverished love. If you come before love, certain things in love that don't
Mhm.
matter, like caring about people's feelings don't matter. Only thing that matters is surviving for the day, and that's not healthcare. Yelling in people's faces, clapping in people's faces. When you ask for help, like eyes rolled and walking away from them, that's not my job. All kinds of issues. And, you would tell the company, like, they're saying they're not hired to do these jobs, they're not medical people. And then they would tell us, but they are, they're supposed to help you. And we shouldn't have been in the middle trying to figure it out.
Right.
I mean, I had a few different people that I worked with that were literally ran out of the house as the nurse was trying to correct them about the diets, like it had to be pureed, and she's literally looking at the plates, and when she speaks up, like for the people there, just start yelling at her, and when she leaves and she reports them, like when she comes into the house, they won't help her with anything. Yeah,
I hear that more and more.
it was a bad deal.
I keep hearing that more and more from people. Like just the lack of support that from upper management that you guys get as nurses, and especially being a registered nurse. Like your say so should be the ultimate whenever it comes to that. And you guys get a lot of pushback. Like can you give me an instance of one of the times you've had pushback that was absolutely detrimental to one of your clients?
Oh my God, the most recent one before I left, I had a patient on a new medication. I was the one in charge of picking up the specialty medication. As they were trying to push me out, and was suspended. Well, right before I got suspended, I could tell they were pushing me out. I had even asked the DON, like, do you want to take on this case? It's very complex. You have to get this stuff in advance. We have to package all this out, put all these things out. And she just decided that she was going to call the doctor and change it to a like medication. And there's no match. There's no match for it. And we had tried that other medication already, and it was not effective. He had a very severe um, adverse effect to his traumatic brain injury, and he needed the medication. Um, and so when I let her know that, I'm calling state, I let you guys know his medication is there. You didn't fill it properly. You change his medication without his consent. You can't just call the doctor and say, "I want this." Like the person has to, an alert and oriented person has to state
Mhm.
these things. Um, and so then I was suspended without pay 5 days later after sending that email. Um, and they tried to, like when I filed for unemployment, they tried to say that I was stealing those medicines and all kinds. Even though I was offering for her to take the case, like and that was the largest. Like that was the last one, obviously. Um,
Uh, can you give me an idea of any of the times where you actually, witnessed one of your clients uh, that they were in need of something, whether it be, a certain type of care or a certain type of medication, and they were actually being, denied being given.
So, the patient that I was talking about that had been kept in his room, he had had a renal surgery, um, and he had came back from surgery with very clear instructions. He had pain medicine. He needed help to use the bathroom, but we couldn't be doing everything. It was very specific. He needs a pillow to cough, multiple things. Um, and then when the nurse went in the next day, he had not had any pain medication. One of the other staff finally admitted that they had been asking for medicine, but the night staff just kept telling him to shut up and stay in his room. He needed a rest, and that he would be in so much pain if he didn't keep trying to get up. And even though, and that same staff also reported out that he had been trying to call up for help, but no one would come and see what he needed unless he was, and they were working on the other side of the house. Like they kind of assigned each other, like you take this side, I'm gonna take this one. And so they were kind of scared of that same staff member and, didn't feel comfortable speaking up in the moment. That staff, the staff member would regularly cuss at the residents, be very abrasive, slam chairs down and things like that. So I had understanding for this staff. And we know that management is not going to take care of us. Like we're going to report it out, and then it's going to be known that we said something because we're the only few people
Mhm.
in that house, and those people just end up
Yeah.
quitting. So yeah, he was denied pain medication, denied the right to leave his was denied help after a very, he had stayed in the hospital, I think, no, it wasn't 48 hours. He stayed in the hospital 2 days after and
Okay.
then came home with those orders, and we just could not get the staff to help him. And of course, when I went to management, they first thing told me, well, nothing's, we can't hear any of the sound. You can visibly see the man waving his arms at me, telling him to go. And yeah, and when I called state about that, I finally got a call back. That was in 2023. I got a call back from them in 2024, the following year, and it wasn't even like it was past a year. It had been a year and some months since I had called before they got back to me to do any the state. And then, of course, the last state report I had made out. They were making fun of a young adult who had had a prognosis of death. The disease he was
Mhm.
was battling with was going to, and it was going to be soon. Um, and so the staff would make fun of him and tell him he's faking it, and things like that. I went to our psychiatrist and let her know, like, these things are happening. I think he's having trauma induced things. Um, I'm trying to be careful about
Right,
giving
right.
out information and making myself sound stupid, calling it things. I know the specific name. I'm trying to be discreet. Let her know, like, he needs
Mhm.
additional therapy. He needs additional support. Like these staff are doing these things, and she just completely overlooked it. And then, because the mother still contacted me after they submitted, because this was my last report out, and it ended up getting noted that specifically what I was stating was happening was the cause of his increased problems in his disease process, specifically because the trigger trauma he was experiencing and not receiving enough therapy for, on top of that was causing part of the disease process. Like, so I had called the state about that case, and it turns out, depending on whether you're in supported living or behavior, fall under different licensure. So I had to call three
Oh,
different entities to report these people for two different
okay.
houses. And the last guy I spoke to, he's like, you need to call the governor. It should not be this
Wow.
hard. He said the reason this much abuse is going unnoted is the amount of difficulty it takes to get that reporting party notice of it happening and their requirement to do something about it, because it always looks like it's falling under someone else's jurisdiction.
All the hoops that you've got to jump
It's
through just to help protect somebody, you know?
yes. And in the meanwhile, putting your livelihood on the line, and then the colleagues who do
Oh, hold on, your audio's faded out again.
sorry.
It's kind of fading in and out. Your audio is. Go ahead, go ahead. I can hear you again though.
So it just it when you do report, like you're not just like having to go through those hoops and try to protect the patient. You have to protect yourself at the same time, from your colleagues, from management. My nursing peers right next to me the whole time, they're just be quiet. You just can make your money and go home. You don't have to deal with these things. And and then calling me a suck ass or whatever it may be. Like this is my job. This is my honest living.
Hmm.
Nobody see anything. I don't think you understand it. Like this is my calling to do this. I don't have no choice to do it any other way than this way, the right way, the honest way. I'm not going to turn a blind eye to
Yeah,
anything.
and I said
It's also part of poor love. Like,
I
you
feel
know,
like that.
you don't, once you come out of those who survive poor love and come out the other side, there's no way anyone's going to have anything going with us. We let that happen to us for way too long for us to ever. So I come from poor love, made it to the other side, and then got my RN degree. I'm
Right.
telling.
I
I'm
think that
telling.
kind of contributes to that level of burnout too, like because you just start getting so fed up with that stuff.
Yeah. I and my sister keeps trying to talk me into finding like maybe a work from home nursing job. I've been in multiple settings. Um, and again, there's not anyone that I get to just take care of people and the management supporting, or we're supporting
Hmm.
with enough staff to do the job right, like the nursing home or the hospital. Like you have no control over your body in the hospital. What you have to put in, and even they had us do these breathing tests where they want us to inhale this liquid of whatever. I'm not putting anything into my body. If I'm not sick and my immune system is working well, you know, I know healthcare. I know it's not okay to continue to put false
Hmm.
things into our bodies. Our bodies were made to work off of what was here naturally.
Absolutely. You know,
I understand emergency medicine. I believe in emergency medicine. I believe in medicine for those who have been, chronically injured, brain injuries. There's those that allows those people to live on and things like that. But
yeah, I keep coming across people, more and more that the lack of support that's it's driving them away from the good job that they were doing. And uh it wears on the not only the staff, but it also wears on the clients as well, like because they when you're not getting that kind of support, you feel
no,
alone out there.
no, my last job of sticking up for those almost like well it did almost got me accused of felony theft. Like that doesn't only cost me my license. Like of course they couldn't prove it, and but they're they're that willing to let all those people be that injured and that uncared for. What's the next level? Just planting the evidence to make sure I'm quieted the next time. Like I don't feel comfortable to go back into any nursing setting with these people. I know my colleagues are not trusted. I know management is not trusted. There's
Just seems like they're throwing bodies at the
I
situation.
don't I love to get paid for my job, but they're making way too much money, and then people, I don't know, the breed or whatever it is,
That's absolutely crazy.
I don't want to make less, but something's got to happen for us to understand that this job is not supposed to be about the
Absolutely.
money.
That's, ultimately that's what I would have never guessed that, like so many nurses do look at it as, well, it's a paycheck, and then you come across nurses who actually do care, and those nurses they're not just looking for a paycheck, they're there with concerns, and a lot of times they get those concerns just swept under the rug.
Yeah, my first med air, it was a pretty big med air. It was insulin. I thought I was giving her Lantus. So the nurse before me had dropped the bottle into
Hmm.
the wrong boxes. So I made sure I had the right box, but I didn't check the label on the bottle until I was setting it down or until I went to put the medication away after I'd already injected her with 30 units of fast acting insulin. So I immediately went to my supervisor, um, called her on the phone. What do I do? Of course, I'm stuffed her full of every sugar plants that I could find close to me. Um, and so she walks me through, and she just wanted me to write off and fudge the paperwork and not call, yeah, the guardian of the. I was like, absolutely not, and I went to the administrator. Like this, we don't cover that stuff up. These are
Right.
moments. As the nurse, you're mess up. Know that you're gonna make big mistakes, but if you are not honest, the system never fixes. And if you're not honest about it, peers, fellow nurses, they don't understand. And I hate for the community to know, but it happens every day. Mistakes happen.
Yeah. Yeah.
And it's part of it is the understaffing. I was rushing to do a haul of 30 patients in a 2 hour med. They all have 10 pills and five creams to rub, and you're supposed to do all that in 2 hours.
I mean, yeah, overload is,
And that's if no one needs to use the bathroom or needs a glass of water, or anything outside of medication.
overload is a quick way for burnout too,
And yeah, one nurse, two CNAs. Am I going to call that CNA and ask her for water? Hell no. I better go get it myself.
Right, Oh, but that's part of, we're part of the healthcare asylum, so like that's what we're talking about. Dana, I really want to thank you for coming on and talking with us today and giving us a little more insight. And hopefully I can have you back on in the near future and we can go a little bit deeper into this. I always have fun talking with you, and it's really great to touch base with you on this again. And I hope you have a good rest of the day today.